Last time the President addressed us, remember, was the 17th of June, nearly 4 weeks ago. Now, at that stage, there were more than 80,000 confirmed coronavirus cases and around 1,600 people had died. Fast forward, and as of yesterday, there were more than 260,000 cases and new deaths reported yesterday, taking the death toll to nearly 4,000 people. There were also a record of new cases in 24 hours, 13,500 in one 24-hour period. Now, when the President spoke last, the Western Cape was the epicentre of the disease, but Gauteng is now the worst affected province. To discuss the course of infections, let's look at some of the science now and look at how things have changed from the President's last address to now. We're joined by senior researcher at the Council for Scientific and Industrial Research, Dr Ridhwaan Suliman. Dr Suliman, thank you very much for being with us. You're with us on hybrid because you're being load shedded. So let me be very clear. We're going to bring up some of the graphs that you gave us. Thank you very much. Tracking COVID-19 cases. So I will be clear what we're bringing up. Firstly, the average daily COVID-19 cases per week. We know that yesterday, in just a 24-hour period, there were 13,500 new cases. So are we seeing a big jump recently, or has it been a pretty consistent trajectory? Take us through this first slide.
Good evening, Francis. Thank you for having me. Yes, indeed, what we have seen is a continued exponential growth in cases and a recent surge that is mostly being driven by cases from the most populous province in Gauteng. So to quantify this exponential increase, one can make use of the doubling rate, which is a measure just to see how quickly the numbers are doubling. But this particular measure has been consistent at around 14 days or just under 14 days, meaning cases are doubling every 2 weeks. If we look at the graph that you just mentioned, since the last time that President Ramaphosa addressed us, which was around week 14 or week 15 since the first confirmed case, you can see that we were seeing about 2,500 COVID-19 cases per day over that week. Fast forward 2 weeks later to week 16, you see that the number doubled to almost 5,000 cases per day. And then if we look over the last week, in week 18, that number has doubled again, and we're seeing just over 10,000 cases per day on average over the last week. So what we're seeing is a continued doubling every 2 weeks in cases.
All right, let's look at then the average daily COVID deaths per week. And this graph is a little bit different. There seemed to be a holding pattern for 2 weeks or so, but now that death rate jumping up. Take us through that. Indeed,
yes. So the deaths have been lower than expected and lower than the global average, fortunately. However, as you mentioned, the death numbers do lag the case numbers. So if we look at this particular graph, you can see that there is a slight lag and a sort of a plateau of sorts. However, in the last week, we've seen the spike in the number of deaths. And because the death numbers do lag the case numbers, we need to watch this closely because this could follow the same trajectory and spike as well, following the case numbers.
Yeah. Very worrying. You mentioned the doubling rate. So let's bring up the doubling rate of COVID-19 cases in South Africa. This is something that the President himself mentioned in the last address, one way to measure the rate of transmission. So the doubling rate is the number of days it takes for those infections to double. And it seems like it's pretty consistent, isn't it, Doctor?
Indeed, it has been fairly consistent since around level 4, in fact. We're seeing this doubling rate of just under 2 weeks. Even though it's consistent, we must remember that this is exponential growth, and that's why we're seeing these staggering numbers of late. We're seeing these record high number of reported cases. This doubling rate of 14 days is very high indeed, and we need to bear in mind that this is looking at a global comparison. This ranks out of the top 20 countries with the most confirmed cases. This is the highest doubling rate that we have.
So this is kind of responsible for putting us on the map right now. We know we're number 10 in the world. Speak to the graph that looks at another doubling rate, the doubling rate of COVID-19 deaths in South Africa.
Yeah, so similarly, this is a measure of how quickly the number of deaths due to COVID-19 is doubling. What we're seeing is that this is slightly different in that it's a bit lower than the doubling rate of cases. We're currently looking at a doubling of every 16 to 17 days. As mentioned earlier, the number of deaths is lagging the number of cases, and it has been lower than the global average, but still a number of concern and something to be watched going forward.
Can we cling to that as good news? I guess it could change, right, Doctor?
Of course, it can change. The virus is evolving every day. It is good news for now. What we have seen is a lower case fatality rate in South Africa compared to global averages. This could be due to a number of reasons. From a data-centric point of view, possibly a younger median population age of South Africa is a contributing factor. Maybe also the early lockdown and subsequent delay in the spread of the virus has also contributed to a lower fatality rate in South Africa. So it is good news for now. What we do need to be cognizant of is that the cases have spiked recently, and that the death numbers may follow suit. So we do need to keep a lookout for the capacity in hospitals and the number of deaths that follow thereafter.
Okay, let's look at capacity in hospitals, and of course this is the thing that has really changed in the last month or so since the President spoke. So let's bring up the hospital admissions now. You can talk to that. The city press has been reporting that new hospital admissions in Gauteng up more than 2,000% in recent weeks. So it sounds like an explosion happening. Just tell us about this graph.
Yes, so indeed, I guess with the recent surge in cases, naturally, a percentage of those cases need to be admitted to hospital, unfortunately. And what we're seeing then is that the hospital curve is following the cases curve. In this particular graph, where the absolute numbers are not quite as accurate, since not all hospitals report for this particular figure, what this graph does show, though, is the continued increase and the continued demand on the hospital capacity. And as you say, some hospitals now reporting that they are overwhelmed by the number of admissions.
Yeah, the health minister says field hospitals need to be prioritised. So that is quite urgent now, looking at your graph, the beds.
Yes, indeed. And if we continue on the same trajectory, we spoke about the doubling rate. If that continues, what we see is that cases will double again in 2 weeks' time, which means that the capacity that we require, the number of beds that we require, will also, the demand rather, will also increase. So yeah, definitely, if we continue on the same trajectory, we will need to increase the capacity and in particular field beds in field hospitals.
Yeah. And of course then a concern is whether we're actually getting the real picture in terms of the testing. So let's bring up your plot showing testing in relation to the scale of the outbreak. Yesterday the health minister said over 51,000 tests done in a day, but is the testing sort of keeping up with the cases, with the infection and catching the real picture for us?
Yeah, so first to note, as you've pointed out, that over the last 3 days we've seen an average of over 50,000 tests per day, which is really commendable, and we do need to appreciate the effort that has been put in by those lab workers. However, that being said, the rate of increase of testing has not kept up with the rate of increase of the infection. So if we look at the positivity rate, which is the number of confirmed cases as a percentage of tests, what we're seeing over the last 2 weeks or so is this positivity rate is above 20%, well above the level that the World Health Organization put of 10%, which should raise concern. So this percentage of over 20% means that we're finding a positive case for every 4 to 5 tests that are conducted. So unfortunately, the testing hasn't kept up with the rate of increase of cases. If you look at one of the curves which shows the testing in relation to cases, we're seeing that the number of cases has just run away, and the curve sort of flattened to a horizontal, whereas what we want is that curve to move towards the top left, where the number of tests are increasing and the number of cases at the same time are either leveling off and then decreasing.
Okay, suggesting that the picture could even be worse than being reported in South Africa. Let's end off with a provincial picture. Let's bring up total cases per province. Now, when the President last addressed us, the Western Cape was the epicentre. That was in June. Now you can clearly see here that Gauteng has taken over with over 90,000 total cases, and Gauteng moving quite quickly. What does this graph tell you?
Yeah, indeed. So this graph, it shows a few things. Of note, what you've pointed out is the recent surge in cases in Gauteng. We're almost at 1,000 cases, 1,000 confirmed cases in Gauteng. So since the last address by the President, the number of cases in Western Cape has sort of plateaued or leveled off. We don't know if this will, how long this plateau will last and whether it may increase or not, but definitely the shift has moved away from the Western Cape to Gauteng in recent times, but also in the Eastern Cape and KwaZulu-Natal, we're seeing a surge as well in cases. So if you look at this plot, you want to look at the slopes of these curves because it is a logarithmic scale, and the slope of the curves gives an indication of the acceleration of the spread of the infection.
So you're right, Gauteng trending upwards, the Western Cape seeming to flatten a little bit. Let's end with the death rates. And while Gauteng has the highest number of positive cases, the Western Cape seems to have quite a substantially higher death toll. Take us through that, Doctor.
Yes, indeed. So as indicated before, the death trajectory follows the cases trajectory. So with Western Cape being the epicenter of the virus for a long time, naturally the number of deaths has been higher in the Western Cape up until now. We're seeing there, similar to the cases trajectory, is a start of a plateau or a start of leveling off, which is good news for the Western Cape. Hopefully, a plateau happening there. What we're seeing of late, following the cases trajectory, is a recent surge in deaths in Gauteng, unfortunately. Over the last 2 weeks, in fact, the number of deaths in Gauteng in particular went from just over 150 to almost 600. So that's well more over tripling of the deaths in just the last 2 weeks. So yes, now the virus has shifted and the epicenter is definitely in Gauteng. One also needs to keep a look at the trajectory in Eastern Cape as well as in KwaZulu-Natal.
All right, thank you very much for running us through the hard data. This was looking at COVID-19 in graphs with a senior researcher at the Council for Scientific and Industrial Research, Dr Ridhwaan Suliman.